Hi, I'm Jeff Strakowski, and the hot tip of the day is finding the median nerve at the carpal tunnel. We're going to look at it in both long and short axis and identify the surrounding anatomy. We'll actually start with the short axis view. With most things in ultrasound, it's helpful to find the bone acoustic landmarks first, and we identify that. So we're going to look for what's called the carpal tunnel inlet after we've identified the median nerve. So the median nerve can be identified by its fascicular architecture, and it looks like a honeycomb appearance where it's darker fascicles compared to the really fine fibular architecture of the surrounding tendons. We can do what's called toggling the transducer, and you'll notice that the surrounding tendons have more anisotropy, so they will change to a much greater extent than the nerve does. So these are the surrounding flexor tendons. There's the median nerve. So if we have trouble actually identifying the median nerve down at the space where we're interested, we can always go backwards and move to a place more proximally where it's mostly muscle, and you'll see that the nerve stands out in greater detail. And this is also a good place to measure the nerve when you're trying to compare a normal to an abnormal nerve that might be swollen at the carpal tunnel space. So here we're going to look at that bone acoustic landmark that I mentioned. We're going to see the rounded dome of the pisiform, and we're going to see the rounded facet of the scaphoid. This is the carpal tunnel inlet, and oftentimes the area of the greatest enlargement. Here's where we see the transverse carpal ligament that overlies this area. To this portion of the screen here, we see the ulnar nerve and the ulnar artery. You'll notice that the transverse carpal ligament makes the floor of what's called the ulnar tunnel that contains the ulnar artery and the ulnar nerve. The median nerve then is followed even more caudally, and we'll see that the rounded pisiform changes shape, and now we're at the level of the hook of the hamate. So this is called the carpal tunnel outlet, and this is the area where the median nerve is generally most entrapped. So we can see this thicker transverse carpal ligament at the carpal tunnel outlet. This is the trapezium and the bony landmark of that, and the surrounding flexor tendons. Lori, can you flex your tendons for me? And so this is the flexor pollicis longus, flexor digitorum superficialis tendons, and profundus tendons. As we move back, we'll change the orientation of the transducer to a longitudinal position. Now we see the median nerve on top with underneath the flexor digitorum superficialis and profundus tendons of the fingers. So this is the median nerve. We note how it has a fascicular architecture. Here's the carpal tunnel space in the lunate, and we can move these flexor tendons back and forth. You'll notice that the median nerve has excursion, but not to the same extent as the tendons underlying. That's a good way to look at the carpal tunnel. Now you give it a try.